Global Integrity is one of the founding members of the initiative, which started in April last year at the height of the pandemic. We witnessed quite a significant number of changes that spurred the need, particularly amongst civic actors who are working on issues of fiscal governance, transparency, and accountability, to deal with the outbreak of COVID-19 and the impact that it was having, not just on health and basic service delivery systems, which were being placed under considerable strain across the world, including Africa, particularly because of the fragile health systems that came about as a result of the aftermath of the pandemic. And we started to witness amongst civic actors that a lot of the international financial institutions, private foundations, development agencies were pledging billions of dollars to governments to successfully combat COVID-19 and to also cushion the most vulnerable populations from the socioeconomic impact of COVID-19. And we also witnessed similarly how those weak health systems were impacted by COVID, that similarly when the funding from various donors and funding sources began to pour in, we also started to see how the pandemic was also putting pressure on the public financial management systems in the region. And it also exposed various weaknesses, gaps, and exposed also elements of corruption within the public financial management system, as more and more questions were being raised as to the extent to which those funds were being utilized, particularly when it came to procurement, and the way that governments were bypassing some of the public financial management checks and balances as a result, in order to be able to respond quickly to the pandemic. And there was less transparency because government's argument were, we don't have time to consult, we don't have time to be open and to go through the normal processes that we normally go to, because these are not normal times, these are abnormal times. So this is the kinds of arguments that civic actors were up against. And in addition to that, you were also seeing that a lot of the civic actors were having to work from home, because of shutdown measures. They weren't being able to go to government offices in person and, engage in ways that they typically engage. The legislature weren't meeting, parliament was shut down, so they weren't engaging in the oversight that they had been mandated to. So we really found that in April, a group of civic organizations that Global Integrity partners with, Budget, Code, Accountability Lab, the Public Service Accountability Monitor, Afro Leadership in Cameroon, we came together to collaborate on an initiative called Acc4Covid that seeks to promote and advocate for greater accountability and inclusion and transparency of COVID-19 public funding, particularly the allocations and expenditure. And the effort really was to explore how we can gather actors from across the region who are doing similar work, to not only analyze the impact of COVID-19 on fiscal governance on the continent, but also to create a platform where civic actors from across the region could exchange ideas and lessons for possible strategies to improve transparency and accountability and participation, to address transparency and accountability challenges and opportunities related to COVID-19 in their contexts. And that was really the vision that we had for the initiative. And since the initiative launched, we have had a series of webinars that touched on oversight, anti-corruption, regulations and mechanisms, strategies concerning COVID-19. We've also looked at the socioeconomic impact of COVID-19 and the role of transparency and accountability. We've had, webinars that looked at access to information and the data gap and how to address that, strategies to address that from different civic actors who are facing similar challenges across the region. And this year, obviously, the main focus right now is on vaccine distribution. And that adds another element, another layer of transparency and accountability that also looks at the tracking vaccine delivery and tracking to ensure that government is utilizing procuring vaccines appropriately and also distributing them appropriately, and the role of public funding ensure that the vaccine delivery effort is successful. So that will be our focus this year in the Acc4Covid webinars. So the first one we've already had that looked at how we can work around improving vaccine equity and the role of transparency and accountability to improve equitable access to the COVID-19 vaccine in Africa. And the next Acc4Covid webinar will be looking at vaccine misinformation and vaccine hesitancy, and what civic actors working in transparency and accountability can do to help with fighting vaccine misinformation and making sure that transparency can help to ensure that people are not hesitant to get the COVID-19 vaccine.
Thank you for such a detailed and thorough introduction, Yeukai. I really appreciate it. I believe Joshua has joined us now. Yay. Hi, Joshua.
Hi, how are you? Thank you.
Yes, thank you for joining. I wanted to just to open the floor a little bit to you to talk a little bit about your experience with Acc4Covid, and specifically some of the case studies from your country that you've been able to contribute to.
Okay, thank you very much. My name is Joshua Changowny, the Executive Secretary of the Constitution and Reform Education Consortium, CRECO. We are based in Nairobi, Kenya. Thank you so much, Civic Global Integrity, for this invitation and the opportunity to share our experience in Kenya. Maybe a little bit about CRECO, just in a minute. CRECO is a consortium of civil society organizations that came together in our country in the 90s for championing constitutional reform to ensure that we have a democratic constitution where citizens are able to air their views and participate in the meaningful development of the country. And since then, we've been working very closely to conduct civic education and do monitoring of safeguarding human rights in our country. COVID-19 pandemic, which is said to have begun in China late 2019. The first case in Kenya was announced in mid-March 2020, and of course it got everyone shocked, confused in terms of what could be done, given the largest numbers that were reported as dying, as being in ICU beds and all that. So even as in civil society, this thing called working from home, taking measures not to be in contact with people. So I think it was taking us away from our usual practice of doing things. And I believe even in terms of preparedness as a disease that would be probably spread very fast. Of course, it was not the first time, to hear of such kind of a disease, because we've had Ebola in the Democratic Republic of Congo and our neighboring countries, and we've had our government even preparing in terms of our border points and all that kind of stuff. But when this pandemic began, our government enforced, or rather imposed restrictions of movement, which we've never had before. We would just read in books, history books in terms of state of emergencies when Kenya had not gotten independence and all that kind of stuff. But of course, to be told not to move from one place to the other was something that was very peculiar in our country. Mandatory quarantine for people from outside the country. Those were things that probably would confuse people at some point. And then, I mean, curfews, I mean, restriction in terms of timeline of movement from one place to the other, and it is still in force even as we speak today. Then mass procurement and distribution of various medical supplies in different parts of the country. Of course, we would hear of several protective devices that would be given to people who are providing essentials, like for instance, in our hospitals, those ones who are in the security sector. But of course, we would not even see them. But of course, those such kind of announcements would be coming. But of course, as civil society organizations, we're asking ourselves so many questions around transparency and accountability, which arose as a result of, because we've been used to demanding for accountability when we know that people are operating in the normal times where they are physically in the offices, the channels of communication are regular. But here is a situation where you've been told remain in your homes. Government is under control. Government is implementing all these measures that have been put in place for the sake of public safety. And of course, we would be curious to also look at how these measures would be enforced. I mean, and the requirement by citizens to comply. And as CRECO, we were so curious to see on how human rights were being safeguarded as these measures were being enforced. And that became the bulk of our work in 2020 to make observation of what was going on with the security forces, these ones that were gotten to be violators of the measures that had been put in place in terms of movement and curfews. But CRECO monitored human rights violations and worked very closely with like-minded organizations to monitor the use of public resources. And of course, I do to be good, I mentioned, such organizations as Transparency International Kenya and the Kenya Human Rights Commission. Most of these organizations are our like-minded organizations that we work with. Some of them are CRECO members. And I mean, in terms of looking critically of the issue of accountability, we would delve and say accountability is something that is beyond the mere responsibility of the delivery of tasks of services by government. It also means answerability. I mean, the government answering for any actions and services that they have not delivered in good time or in an efficient manner, that it becomes a burden to the citizens. And of course, in this case, we engaged in talking to people. And of course, one of the organizations was Global Integrity, where Global Integrity put us in a platform which is called Acc4Covid, and we've been learning from our peers from different parts of Africa and also other continents like the America, where different resources were shared with us, and we've been using those tools and sharing experiences from one place to the other. But now, today gives me an opportunity and privilege to share of what we've been, what has best happened in our country. But let me first begin with the best practices that we've observed as civil society organization of what has been happening in our country in Kenya. I think it is good to give credit that there was establishment of the COVID-19 Emergency Response Fund and the financing through multiple sources, which was made available for any kind of response. And for us, we take that positively because even the private sector were mobilized, the donors were mobilized, the bilateral partners of our government were mobilized. These are the likes of the African Development Bank, the World Bank, the European Union, and all those. I mean, a lot of resources came, and including also philanthropists that gave us, the PPs, including Jack Ma of China. I mean, those. So we would hear that there was good response in terms of trying to support Kenyans and ensure that they would not be affected so much by this pandemic. Then the public finance management of the emergency response fund regulations was put in place in 2020, but these were only in reference to the existing regulations that we have in our country. Then thirdly, the government would publish summary of Kenya Medical Supply Authority awards. I mean the contracting, the details of people who are given, the date, the amount, and all those. And for us, I think that was something that was very good and very attractive, so that citizens who were probably had been limited in terms of movement and interaction would get this maybe through the media, social media, websites of government. And then lastly, the audit, that were happening from time to time. And then, of course, making this public. And then again, as even they made it public, the government officials would appear regularly on the local media to offer daily briefings, which was very good in terms of positive cases, people who have been hospitalized, the pressure that the health facilities were getting, the measures that are put in place to ensure that citizens would get those services, even alternatively, where these services were a bit more rare. So for us, we find that to be more attractive. But now, again, we would observe quite a number of shortcomings. I mean, in terms of ensuring that there's transparency and accountability in the management of COVID-19 funds and other resources in our country. And I would begin with, the level of preparedness by our government. At that time, we would hear that, flights, these international flights, which were coming from different parts of the world, the government would tell us that this pandemic has affected quite a number of government countries in Europe, in Asia, specifically China, but flights kept on coming to our country. I mean, and for us, we would see that as lack of accountability. And it took only citizens to expose that. And there was a whistleblower at the international airport in our country who took photos of, Chinese citizens, arriving in our country, whereas the government had communicated otherwise. And of course, we would find that as an accountability issue. And the raise of, the alarm by private citizens on that, it was a milestone in terms of like holding the government accountable of having communicated that there's stoppage of, external flights coming to our country. And they continued, I mean, which for me, it's very attractive in terms of holding them to account. Then they put a measure of, putting into quarantine, the foreign travelers. But we didn't know what was happening in those quarantine facilities. But it took the media, civil society, and the public, to explain people were suffering. The no accountability for violations of health guidelines and detention of citizens in those conditions was something that, would require our efforts as civil society to champion in terms of safeguarding human rights of people who did not even have capacity, probably to speak for themselves. Then I would want to talk about the, the personal protective equipment and the medical equipment, which, very few people have knowledge about these things. I mean, the COVID-19 is what made us probably now to understand what is a mask. There was a lot of overpricing of these masks. You cannot believe even the prices that we have now in the market. It's too cheap. I mean, and in the beginning, when you compare with the information of last year when COVID-19 was reported in our country, these masks were not affordable. I mean, there were things which were being described as some, equipment and let's say materials that would be designed and prescribed to have a lot of money and all that. And of course, with the whistleblowing of what was happening, and of course, the audits that were done under the demand of civil society would expose what is popularly known now in our country as COVID millionaires, people who made money, people who made a kill as a result of this pandemic. And of course, people now have had to demand that even with the current, dispensation of the vaccines, a lot of transparency needs to happen, including, the communication by government that there's lack of oxygen now in our medical facilities, and there is a call for availing, oxygen cylinders in various medical facilities. So this is the first time we are talking technically about issues that probably was within the confines of medical experts. So the common citizens now talks about these things because it's a matter of life and death. Then thirdly, allow me just say that we've continued monitoring this, and we've always called on government to ensure that there's clarity in terms of their information and monitor the expenditure of these resources through tracking of the budgets using the various institutions that have been provided for in our constitution, like for instance, the Kenya Medical Supplies Authority, the Ministry of Health, the Kenya Medical Practitioners and Dentistry Unions, the ethics and the corruption, because in the beginning, even for them, they were confused. But as things unfolded, there was a lot of demand for accountability from civil society for these institutions to ensure that all is well. Then to conclude my presentation, because I needed to be brief, allow me just end my presentation by quoting the UN Secretary General Antonio Guterres, where he said in 2020, and this was amidst this pandemic, that collusion among those who control supply chains has led to outrageous costs of much needed goods, skewing the market and denying many people life-saving treatment. We must work together to stop such thievery and exploitation by clamping down on illicit financial flows and tax havens, tackling the vested interests that benefit from secrecy and corruption, and exercising utmost vigilance over how resources are spent nationally. Together, we must create more robust systems for accountability, transparency, and integrity without delay. Thank you so much. That is the end of my presentation.
Thank you, Joshua. I wanted to ask you and Yeukai a specific question about what you've seen that's actually been working. Have you seen any civil society organizations or any of the work that you're doing to push forward for accountability? How has the government responded, and what do you think is actually working right now?
What is working right now is multiple efforts. There's no one strategy that is being employed and that is termed now to be working, but we have a multi-layer strategies, including, for instance, the government borrowing loans from international agencies such as the IMF and the World Bank, and citizens have demanded, more specifically through human rights activists, demand for accountability and disclosure of these loans, because we end up paying, we end up being the ones who will be paying through the taxes that we are pulling as citizens. And since now there's still these measures of people not gathering together, probably to engage in conversations or let's say demonstrations, because now under the guidelines that has been put through the executive order by the president. So we've gone to the social media, and you must have seen now Kenyans were very raged in terms of demanding for IMF not to loan more money to Kenya unless there's full accountability for the same money, because the perception out there is that this money is stolen by a few individuals. So you continue bringing money, but there's no benefit to the citizens. We've seen that working, and of course, even with the application of force by the security forces by arresting those ones who are demanding for this accountability, civil society have already, in solidarity, gone to court and get lawyers to represent the activists who are being arrested, and we've seen that working. And this is as latest as yesterday, as one of our activists was also appearing in court, and of course there was no basis for them to be prosecuted and being deemed to have violated any law in our country by trying to demand for accountability. Then secondly, they're working very closely with the oversight commissions or the departments of government, such as the Office of the Auditor General, by demanding the reports on specific funding that was deployed by government on the areas of containing the COVID-19. And this could be at the national level or at the county level. So the provision of information to different actors, wherever they are in our country, has really worked very well, because again, when you have information, it becomes power, because if you do not have information, you become disempowered. Then we've also had to reach those ones that have been elected to represent, and more specifically in the legislature, to demand for accountability. And we've had also the committees in our parliament, because we have two, we have a bicameral parliament, the Senate and the National Assembly. So we've had to engage a specific parliamentary committee to demand for accountability on specific aspects, especially those that have been exposed by the media. So we pick up. And of course, lastly, we've had to engage through presentation of petitions that are signed by civil society organizations to demand certain aspects, and including the politics that are now come around the vaccine of COVID-19, because we've had different, you remember during our last webinar where we had experts explaining to us different types of vaccines and the rate at which citizens get vaccinated. So we've had also to demand for full exposure and disclosure as to where is the origin of these vaccines, as to why some people buy it, and why citizens need to get it free, and what kind of resources have been deployed to the acquisition of those vaccines. And even when the government announces to say that there's shortage of vaccines, we go ahead even to demand as to the implication of that shortage that comes within our country. And of course, we've had to engage experts, because we cannot claim to be the experts, but of course we can be the loudest in terms of demanding, what needs to be put in terms of answers from government. But we also get information from experts, and these are the people who are in the medical field, the union of doctors, the nurses, and all these other people like scholars, just to simplify information for us, so that Kenyans are able to speak loudly from a point of information. Thank you so much. And I think that must have been a very long answer from me.
Right. So just in terms of some of the results, we are seeing, particularly from civic actors working on the region, about some elements of improvement. So people we've had brought onto the Acc4Covid panel have really shared as Joshua also shared, the impact of social media and civic mobilization, and being able to document in real time the impact of COVID-19 and why transparency is so instrumental. And I think a lot of people have seen the shock factor, have definitely been moved by a lot of the media exposés, the social media videos that actually show what, when governments are not transparent, when governments are corrupt, that it actually does have life and death implications. When you see hospitals are full to the brim, when you see people struggling to get access to just basic needs because they're not going to work. I think that really kind of spurred citizens to ask a lot of questions and to mobilize them to demand for transparency and accountability in ways that civic actors have been trying to push for transparency and accountability for quite some time, but haven't really got that responsiveness from the public. But I think this time around, given just how closely connected people could see and hearing, from governments, from donors, that money is being allocated for various needs, but them not experiencing it, not seeing it on the ground, spurring them to ask questions and demand accountability. And we also had civic actors sharing anti-corruption movements, being able to expose, for example, public procurement, corruption, where government stakeholders were taking advantage of various loopholes in the public financial management structure, and media being able to report on those stories, just further enraged and further mobilized people to really want to push government, to put pressure on government to respond and be more transparent. And I think in addition to other tactics that were working was the fact that simultaneously citizens and civic actors were also putting pressure on financial institutions and donors and private foundations, etc., to attach very strict conditions tied to transparency and accountability, particularly not just reporting directly to them as the funders, but also to the public on how they were utilizing the funds. And at attaching those kind of conditions, we started to see some results. And I know particularly in certain countries, there have been special auditor general units that have been set up as a way to exercise additional oversight in a time where COVID-19 public funding expenditure were bypassing massive regulations, financial regulations. And so you do have, we have seen in certain countries, in Kenya and South Africa, where the Auditor General has a special COVID-19 unit set up to make sure that that oversight is not diminished because of some of the regulations that governments were trying to bypass, checks and balances and so forth. So we have seen some results where the civic actors who have come onto the Acc4Covid panel have said they have seen some improvements. So government publishing some COVID-19 funds, but there's still a long way to go. And I think Joshua can attest to it, is the fact that a lot of the funding data that's out there is not disaggregated. And they're not sharing expenditure data in real time. So it's very hard to kind of find out, okay, you have this general amount sum that has been awarded by the World Bank, for example. Can you tell me specifically which specific programs have received allocations and how are they being used in these particular sectors or these particular programs that people really care about? And you're not able to get that information, you're not able to get that breakdown. And some of that information is still contradicting. So you'll find that on some platforms, they will publish X amount, and then in another government platform, they'll publish a different amount. So there's just some discrepancies. So there's still a lot in terms of the disaggregation, the quality of the data, the comprehensiveness of the data. So some of the information disclosures have, we have seen some results, but there's still a long way to go.
Awesome. And we just have a few minutes left, 2 or 3 minutes left. I just wanted to for your closing remarks, I wanted to ask you specifically, because it is a Pan-African initiative, what you've seen to be some of the factors that have made the response more successful in some countries in Africa versus others. And if you could just keep your answers fairly short, please. Joshua, we can start with you.
Oh, okay. So in my country, we are surrounded by neighbors who didn't believe that this COVID-19 existed. I mean, we have a whole country that did not even try to take statistics on their positive rates, their their death rates, the people whom probably fell ill in their country and all that. And of course, the mass awareness that this is a foreign disease, their country, through prayer cannot be affected by this. And of course, such kind of things, would put us in very awkward positions. And then the other thing is that in as much as they would look like, for instance, nationalistic, but countries are not islands. I mean, we interact in one way or another in terms of commodities, people movement. There are expatriates in that place. There are diplomatic people and all that kind of stuff, including even scaring people who are putting on masks. I mean, that probably putting on masks was something that was not really very attractive until I think at some point they had to relax that and say it's optional now. If you would want to put on a mask, you can do that and all that kind of stuff. But of course, as to the net effect of that, that cannot be accounted for, of course, other than the speculations that we read through the media. And then I think, I look at the fight against this pandemic as not something that probably it is a formula by one country, but it could be a union by several countries because it is about value driven. Like, for instance, if, the cross-border business, like, for instance, if it is there's accountability and transparency and precautionary measures that are put in place in one country and another country does not put that, you can see even there will be a loss in this fight, I mean, to some extent. Then how I look at this is that, how would we also share expertise in terms of probably knowledge sharing? Because we differ in capacity. I mean, the capacity that Kenya has probably may not necessarily be the capacity that Somalia has. but probably they would need certain level of capacity that probably Kenya would offer that. And I think from the geopolitics that we've had to get to, get exposed to, is that we've had even our own facilities being congested and constrained because of people from external countries coming to seek, medical care in our hospitals. I mean, and of course, to some extent, the regional corporations. I mean, here in Kenya, we have the East African Community. We've never seen it really coming out very strongly on how to combat this. We have the African Union, we have the ECOWAS, we have, the COMESA. So they have not been loud as such in terms of putting strategies on how countries would come together in combating this pandemic, and even try to complement each other's efforts in terms of resources, expertise, and even information sharing. So for me, I think there's a lot of loss of opportunity because of the trying of each country living as a cocoon, by not probably exploring some of these economic blocks that we had put in place, or even the political, integrations that had been put in place, such as the African, Union, or the East African Community. So for me, I think there is loss of opportunities, and of course, elections in these countries have had also to be an issue that probably needs also to be dealt with, because an election is a mechanism for public participation, where citizens try to put in place leaders of their choices and try also to retire those ones that they feel that should not continue carrying their mandate. We've seen elections, being carried out in our region. I mean, and we saw in Uganda, we saw in Tanzania, and soon we are also preparing ours in our country here in Kenya. And it is impacting on us. I mean, including, for instance, the use of electronic, voting, where people are so suspicious that is one avenue of rigging elections. The use of biometric identification devices, one quarter arguing to say that probably this is one way of also spreading the pandemic. But we don't know how much that can be accounted for in terms of resources being deployed on mechanisms that had already been invested in the previous election year. So those are things that we are monitoring very closely as CRECO and the other civil society organizations in our country. Thank you so much.
Thank you. Yeukai, unfortunately, we're at time. So I just wanted to thank both of you so much for taking your time out today and speaking. There's really great insights. And for those people interested in Account for COVID, feel free to follow our social media accounts, and we'll be hosting a webinar about vaccine and vaccine deployments shortly. Thank you again, everybody, today.
Thank you. Thank you, Ambika.
Thank you very much. Bye-bye.
Members of this conversation, while Mukorombindo was able to join, I think I heard the presentation of Joshua and